Hello, everyone. Thank you for being with us today on Thursday. Today is a special day in which we're going to highlight some Mississippi businesses, which we're talking about Mississippians helping Mississippians. I will tell you that today I do have a hard out where I am going to have to leave by 3:30 to make my next appointment. And so if we do not get to the questions or to all the questions or to the birthdays, we'll either get you an answer or we'll be back here tomorrow and we'll be more than happy to answer any questions that you may have. I know that we are all ready to return to our normal lives. We all want to reopen our businesses and we all want to reopen our state in a safe way. But our fight against COVID-19 is far from over. We are in the middle of a fight for our state. We must come together as Mississippians to protect each other. There's a reason Mississippi is the most charitable state in the nation. In times of tragedy and crisis, we step up. We lend a helping hand to our loved ones, our neighbors, and our communities. We do whatever it takes to help one another weather each and every storm that comes our way. Now, as we work to fight against this invisible enemy, we see others around the state joining in the fight. Friend helping friend, neighbor helping neighbor, Mississippians helping Mississippians. Today, I want to shine a light on a few Mississippi businesses who have stepped up to help fight against COVID-19. Businesses who have been quietly working behind the scenes to take care of their communities. Like the factories who stopped production to build tanks and fighter aircrafts to support our armed forces in World War I and World War II, these businesses have developed their own unique ways to help fight this invisible enemy. Rather than shutting their doors, they found a way to keep the lights on and a way to support their employees, all while joining the fight. Each of the businesses here today have gone above and beyond to take care of their fellow Mississippians. In times of crisis, we must set aside those things that divide us. We must stand united against our enemies. We must cut the red tape and work together, with the public sector and the private sector working hand in hand. For one such partnership, I'm honored to be part of their special announcement today. When COVID-19 started spreading throughout our country, Josh West, the CEO and co-founder of Blue Delta Jeans, saw a need that his company could fill. Knowing how much Blue Delta Jeans could do to help, he turned to Mississippi Prison Industries Corp. To partner in the effort and increase their impact. With public and private sector united, they hit the ground running to fill a void of critical resources needed in this fight. So at this time, I'm going to turn it over to the CEO of Blue Delta Jeans, Josh West, and to Bradley Lum, the CEO of Mississippi Prison Industries. Josh?
Thank you, Governor. Thanks for having us, and thanks for all your help and support during this entire time. You know, Blue Delta Jeans, we're typically a custom bespoke jean manufacturer in Tupelo, and we're closely tied to sports and entertainment. And so we saw the effects of COVID-19 really quickly. When you make your living flying and doing events around the country, you noticed business downturn quickly. And so we knew we had to make a decision swiftly, and so we did it for two reasons. One is we wanted to keep our people working. We wanted to keep our people employed, and I'm happy to say we have more people in our factory today than we did the day before COVID-19 happened. Another reason we want to do it, obviously, is because of the great need for PPE supplies, and we knew that with our skills and talents in North Mississippi, we could make it happen. Want to just highlight, I think this speaks to the resilience of the manufacturing community in Mississippi. Everything that's going into our mask is being made within really a 50-mile radius of our plant in Tupelo, from the fabric to the flexible nose pieces. Mississippi State stepped up and provided a laboratory for testing. And then all the work by the state of Mississippi, Governor Reeves' team, and MEMA have been critical in helping us not only get this product started and made, but getting it into the right hands. And so the National Guard is involved, MEMA's involved, and then lastly, our partners. So we knew we couldn't do this alone, and so we brought in other manufacturing partners, furniture industries, and then the Mississippi prison industry. And Bradley's going to talk a little bit about their efforts, but these public-private partnerships are good ways to not only help, but also keep people employed during this critical time.
Thank you, Josh, and thank you, Governor, for your leadership during this difficult time. Certainly, as this kind of evolved through the last week of March, we saw that with the factories that we have in place at both Parchman and at South Mississippi Correctional Institution that there was an opportunity for us to really help in this effort. I was able to connect with Josh and kind of saw the need that they were working on, and it became evident that it made sense for us to retool some of our facilities for the purpose of helping support them in their mass production. And so to date, we are currently producing somewhere in the neighborhood of 12 to 15,000 masks a day at our South Mississippi Correctional Garment Factory. We're also, on top of that, and kind of a separate project in our relationship with MEMA, producing gowns at Parchman. So our Parchman facility is producing somewhere in the neighborhood of 5,000 to 7,000 gowns, isolation gowns a day for the state. And frankly, I think the need is only growing, and so we're committed to doing that as long as we have to. And we're fortunate that we were able to retool our facilities and get that moving in the right direction. I will say, the idea to do this kind of came from some of our guys who were in one of our facilities in Parchman. They came to our staff and said, look, we want to help in this fight, in this effort. They were doing other things, kind of their normal production, and they said, we'd like to participate, we'd like to be a part of this. And so they're taking great pride in this. And I think that it speaks well to the guys who are in facility that are working, that they want to be a part of helping our state in this recovery effort. And so we're very proud to be a part of this, and certainly proud to support Josh and the work that Blue Delta is doing.
Well, thank y'all for stepping up in these times. And Josh, I do want you to know I did have on my Blue Delta jeans earlier today. I thought I better put on my coat and tie to come here, but I would much rather have them on because they're much more comfortable. At this time, I would like to call on another Mississippi business that saw a way to lend a helping hand, Red Laser Technology, a long-standing IT firm. They retooled their business model to fill an important need in the fight against COVID-19. Avery?
Yes, thank you, Governor. What we did, we're typically a systems integration company. What that means is we can connect networks and camera surveillance systems, cybersecurity, and as the Delta Jeans guy said, we wanted to keep our employees because our guys are hard to find. So we reached out to the rural and community healthcare clinics, and we was wondering, did they have adequate supplies of health PPE equipment? So we reached out, a couple of them were previous clients, and they said, no, we are having difficulty finding the necessary tools to be able to, people when they have test centers set up. And so we said, we would love to help you guys. So we used our people to help us find equipment and medical supplies and equipment so they could fulfill their need of testing people once the test came available, and also monitoring the people that come in and out. So this has helped us keep our workforce intact, and we didn't necessarily have to downsize. We're managing to keep everybody we have, and we're looking to possibly gain a couple more people during this pandemic.
Well, that is absolutely awesome. These are examples of Mississippians stepping up in times of need. I sincerely appreciate every single one of them doing what they're doing, and I know that my fellow Mississippians join me in just saying thank you, although that seems inadequate. So thank you for what you're doing, and appreciate you very much. And we're going to actually switch out the panel, and we're going to bring in some new Mississippi businesses that have stepped up and are doing great things during this challenging time of need. I would ask that our friends from Gigantic Bag, from Fresh Stream Inc., and of course from Lazy Magnolia, Mr. Mark Henderson. How you doing? I think we'll start with John and Donna.
Well, thank you, Governor. We appreciate all that you're doing for these efforts. Gigantic Bag is a manufacturer in Summit, Mississippi. We manufacture on a regular basis for packaging food, bags, can liners, and one of the hospitals that came to us had issues with some of the gowns, and they wanted a gown that was a easy tear off from front and back, that they did not have to pull over their head. And so we got our team together, retooled some equipment, and as the gentleman said earlier, we now have more employees now than we did prior to the virus, and we also are hiring at this point, and we're making them 7 days a week, 24 hours a day, and they are shipping all over the United States as well as Mississippi, and we're proud to be part of it and proud to keep people working. And JD Warehouse is also, Donna manages JD, and we're steadily transloading material, and also which is the raw material, which is made into the polyethylene, which is made into the gowns, the products, as well as biohazard bags and sheeting.
Well, we have our emergency management director that's going to speak a little while later, but one of the danger areas that we had last night was we did have a tornado type area come through Pike County. Did y'all have any damage, or?
We had no damage. We're still out of power, expected to be for about 3 days, they said.
Okay.
Yep.
Yep.
Now, is that slowing down production?
Yes,
No power.
obviously.
Well, we'll
Just
work to
more-
see if we
just
can get
more
that power
people.
back on as quickly as possible. Thank you very much for what you're doing. At this time, I'm going to turn it over to Brian of Fresh Stream, Inc.
Thank you, Governor. My company, Fresh Stream, I work mainly with retailers and distributors across the country and internationally. I also work closely with the Mississippi Manufacturers Association, U.S. Commerce. And when the crisis hit our state, my focus is usually to help Mississippi companies bring products to market. At that time, people from your team at MEMA and U.S. Commerce and Mississippi Manufacturers Association, knowing the resources and the connections I had in industry, asked me to help Mississippi companies like John Taylor with Taylor Industries up in Madison, Bill Hogue with United Plastic Molders in Jackson, and Brad Bradley with Advanced Medical Technology to help find the necessary PPE and other items that the state needs. Instead of sourcing it through medical distributors or through hospital distributors, I was able to use regular retail links in order to find necessary items for the state. Mississippi has a lot of opportunities. Even though the crisis, I think it brings out the best in our fellow citizens. And my thoughts and prayers are with you and your team as MEMA continues to do a fantastic job, and we're here to help.
Well, thank you, Brian, for what you are doing. As I have said repeatedly from this stage, PPE has always been a constant challenge throughout this crisis. We are feeling better and better about where we are as a state. We're feeling better and better and more confident that we are going to have adequate PPE and hopefully as we move through this, actually be able to restock our stockpile. So if we do have a resurgence in the fall, God forbid, or in the spring of next year, that we start from a better position than we started from this time. But thank you very much for your efforts. And speaking of that, I want to move to our longtime friend Mark Henderson from Lazy Magnolia, down in the heart of the Mississippi Gulf Coast. So, Mark.
Thank you, Governor. So, our story is no different than any of the other people that have been or will be on this stage. We're on the front lines as much as any business. We have a tap room where we engage the public and engage in tourism in a very direct way. And as soon as this became even a little bit of an event, we saw an immediate need on our side for hand sanitizer and ways to protect our people from all the things that we saw that were coming down. We went to the store just like anybody would and couldn't find hand sanitizer. And Leslie, our brewmaster, my wife as well, not sure how that happened, but she goes, well, we'll just make it. And I'm like, are you crazy? And she goes, nope, we got all the stuff right here. And we pulled up the World Health Organization spec sheets on making hand sanitizer, and we had the right ingredients, and we made it all happen. And we sold a little hand sanitizer, and we gave some away to the local people, and then the next thing you know, the Mississippi Highway Patrol says, hey, look, we need some hand sanitizer. And we're like, okay, this is not just making 5 gallons in the back. This is now a real thing. And we started working through the process. Department of Revenue was a great help in securing the right permits, actually helping us secure the right permits at the federal level as well. And we've since trained up a variety of other breweries across the state of Mississippi to do this as well, and engaged with some of our other partners. I think Cathead is here to talk about their efforts as well, but we've done a lot of those kinds of things. And if I could ask anything of Mississippians at this point, it would be to remember our service industry partners, these people that are at the front lines, whose livelihoods have been impacted more so than nearly anybody else. I mean, we run a manufacturing operation, and we do hand sanitizer now, we do beer, we also package water. That operation is running full tilt. But the tap room and all of those people that serve food and engage people on a regular basis, those people are really hurting. And if you've ever been to a bar or a restaurant or to a brewery and said, hey, look, can I get a small donation for our cause? And then every time you walked out with a gift for your silent auction, now's the time to return that favor.
That's exactly right, Mark. Thank you very much for telling your story. And it's really the story of Mississippians. And it is the fact that we know that those in the service industry, the fact that so many are hurting today. If there is any way that we as Mississippians can go out and buy local, let's go out and buy local, whether it's the beer that is distributed by Lazy Magnolia or the vodka distributed by someone coming up here shortly, or whatever the case may be. If you can order out in a restaurant and pick up or have it delivered, for Mississippi-based companies, it would go a long way towards helping Mississippi recover from this devastation. So to each of y'all, thank you. And we've got more businesses we want to highlight today. So thank you all for what you're doing. Appreciate y'all. Thank you. I am great. It's great now to switch to our friends at Cathead Distillery, Great River Industries, AA Calibrations, and Almond Printing. And I'm going to start with our Richard from Cathead Distillery. Richard?
Thank you, Governor. Thank you for having me. And literally wouldn't be here today if it wasn't for the support over the last 10 years. We're celebrating our 10th year anniversary next week. Without the great support of our staff and our fellow Mississippians that have bought and distributed our products throughout the state and throughout the country. I basically mirror everything that Mark Henderson from Lazy Magnolia just said, because we are conveniently in the same industry right now, which is making hand sanitizer. We're humbled and honored to have the opportunity to serve the needs of others. And for the last 4 weeks, we've entirely pivoted our operation to exclusively making hand sanitizer. As of yesterday, we pivoted our sole manufacturing plant at Cathead Distillery to a 24/7-hour operation of making hand sanitizer. We also engaged a co-packer off-site to make hand sanitizer to scale to the needs that are out there in the marketplace. And we also have a fulfillment center offsite as well. So we've essentially mirrored a lot of the manufacturers that have spoken before me in engaging and employing additional people, Mississippians, to help service the needs of others. And literally could not have made this possible without the strength and support of our team. I would say the best way to support Cathead is similar to what Mark just said. Support your local bars and restaurants and package stores. And another remark that I want to have is we couldn't have made this happen personally without the public and private partnerships between Entergy, MEMA, and MDOT. So thank you.
Well, thank you. Obviously, it's important that hand sanitizer is going to be critical as we move into the next phase. Obviously, as we are going to continue to be talking about reopening in a safe way our economy, it's going to be critically important that individuals that go into large retail operations utilize hand sanitizer, that they utilize masks that are being produced by many Mississippians, that they exercise extreme, strong hygiene. That is critically important as we move into this next phase, and for Mississippians to be helping in that is a big, big help. At this point, we're going to move to Great River Industries. Greg Bauer is the VP, and we're going to turn it over to him.
Thank you very much, Governor. Great River Industries is a industrial construction company based in Natchez, proud to call Mississippi home. We're an ASME pressure vessel fabricator, one of the larger employers there in Natchez. Do industrial construction projects around the country. You know, with the price of crude, of course, it'd be easy to talk about all the impacts that are happening on us. You know, so projects shutting down, but that would take away from what we're here for. And that is the amazing efforts that we've seen through the community, the industry, the state of Mississippi to pull together and find positives on this. Initially, when we saw this coming, I'm proud to say the leadership of the company moved swiftly, you know, to make changes, and we decided it was a threefold plan. You know, we attacked this on multiple fronts to make sure that our company kept producing for the state of Mississippi and the country. And although it was on separate fronts, it was with one goal in mind. It was to make a positive impact on the people. You know, that was the people of the community first, the people of the business next, and then the people of our projects, because the projects affect customers, major oil suppliers, chemical producers, and then subcontractors and small businesses around the country, and definitely here in Mississippi. So we made some swift changes, and a lot of those immediately in the community we wanted to strike first. We donated 100% of our PPE, our N95 masks, put our projects on hold, took them out of tool trailers, had guys rounding them up, donated them to the healthcare industry, and then reordered for our facilities. We started to donate meals to the Natchez Hospital and Merit Medical, day shift and night shift. You know, we forget these, that's the front line, that's the heroes that we're working to keep our people safe in the community. And then we started to use the local restaurants and distributors to donate meals to our employees because they were definitely affected. There was no way to avoid certain amounts of layoffs. So we've been supplying some meals to our individuals. And then supporting the city of Natchez with any request that we could. If we were able to take care of something for them, we're doing it for them, you know, and maintain financial stability along the way. And then since we are a construction company, we decided to use our project technology. We work remotely all the time to immediately take our people that normally work in the office and have them work remotely. Use what we do best in the field for the best effort to keep our employees safe. So we had them start working from home, similar to working on construction projects. Many of them came from the field. So they started to work from home, stay safe, and to date, you know, we're proud to say we don't have a single employee with COVID, which is a big thing for us because we work around the country so much. And really, it's about just moving forward. You know, I don't envy the decisions you make, Governor, on a daily basis. And as leaders of companies, we make them on a smaller scale. And there's not always a right and a wrong, but it's just people caring for people, doing the best they can each morning. So we thank you for that.
Amen. 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 Well, thank you to Great River Industries and to Greg. At this time, I'm going to turn it over to John Almond of Almond Printing.
Thank you, Governor. It's an honor to be here. Our business is a printing business primarily in North Mississippi. When all this started happening, I talked to several of our team members, and said, look, you know, we need to keep the doors open. What is it that we can do that's needed that will keep providing employment? And Terry Smith, one of our sales guys, came to me and said, I think we can make face shields for the medical industry. And so we went online, researched it, came up with a prototype, and started manufacturing face shields. We reached out to a out-of-state customer of ours that supplied a lot of stuff for some nursing homes, asked them if they had a need for this, and surprisingly, they were on the phones right then looking for them. So we supplied them with some, and they worked really effective. And so they reached out to us and asked us to crank up production. And then we decided, look, we need to make sure that we're covering Mississippi as well. And so another employee reached out to MEMA and said, look, are y'all in need of these? And we've been manufacturing them nonstop since. And it's been a good fit. We're glad that we were able to take 1,800 the equipment from the 1800s and turn it into making face shields for today's times.
Well, that's awesome. Thank you, John. It's truly inspiring to see so many businesses that have joined in the fight. And even today, we have more Mississippi businesses reviewing their business models to see how they can help. Businesses like AA Calibrations. I'm going to turn it over to Larry, the CEO, to talk about his story.
Thank you, Governor. Larry White, and as the governor said, we are calibration services, and what motivated AA Calibration Services was the fact that I woke up one morning and found that I didn't have enough sleep the night before. Didn't have enough sleep the night before because I stayed awake wondering what can I do to help this nation and the state. So I talked to the wife and we said, well, if you do anything, you can figure it out because you was in the Navy for 20 years, you always figure things out. So we looked at it and say, of this list, what can we do? And we say, we can do face masks. Let's look at it. So we went out and start looking at doing the face masks, whether it's the round the ear or the N95. And the fact that I hadn't had anyone with the COVID-19, and my motivation is to do a little bit to maybe help not have a family member or friend get the COVID-19 disease. So we started looking around, went out, got prices and all of that stuff, and I'm happy to say we have a long-term plan, a short-term plan, and a now plan. And we've had no layoffs. We found a way to get through it, and hopefully in the very near future, we'll be looking for even more employees.
Well, thank you, Larry, and a special thank you to Richard, Greg, and to John for all that you are doing to help Mississippians in this crisis. And at this time, as we switch out the panel, I just want to point out that these folks represent Mississippi businesses throughout our state. As you can tell, these folks come from every different region of the state and are just doing fantastic work. You've heard me talk about the fact that the University of Mississippi Medical Center and the researchers at the University of Southern Mississippi have been incredibly important in the process when it comes to testing. But it's also important to note that our educational institutions are also stepping up and finding innovative ways to support their communities and to lend a hand. This afternoon, we have representatives of Ole Miss and Mississippi State, and also Scott Beebe, who is the manager at Fab Lab. And so I'm going to start with Scott and let him talk a little bit about what he's doing.
Thank you, Governor. So Fab Lab Jackson County is a partnership between Jackson County School District, Chevron, and the Fab Foundation, and we teach kids STEM. And I've heard every business up here talk about turning manufacturing alcohol into hand sanitizer or taking this production, turning it into something else. And that's what STEM does. So we teach kids that on a daily basis, how STEM can solve the world's problems. And this is the biggest problem of our generation. So it really come to life with this. So we started researching online, trying to find PPE that was FDA approved because you don't want to do harm. You don't want to provide things that are not of use. So we found a face shield that was FDA approved. We took our 3D printers and we started printing. There were no kids in the building anymore, so we said, what can we do with the idle machines? And we found students and former students that had 3D printers of their own at home, and they started printing them. So we have high school students in Van Cleve, high school students in Ocean Springs, high school students in St. Martin that are printing these at home and taking them to Memorial Health, taking them to Singing River Hospital Systems, taking them to the police departments, taking them to the school district workers that are providing lunches to kids who no longer have meals. It's just grown. The VA, they were having trouble getting PPE. They bought two 3D printers. We've trained them how to use them. They're printing their own PPE now. The Keesler Medical Center, they have a fab shop on Keesler that prototypes things for the Air Force. They started printing the same model. And it's not my model. We found this online. There was a CNN story, so I don't want credit for that. But we did do that, and that is awesome. We're also providing online camps now. So we are doing online content on robotics, 3D printing, coding, electronics. These kids are bored at home. They want something to do. And we are having to kick them out of the room after 3.5 hours. If you know anything about education, keeping the kid engaged for 3 hours is tough. And these kids want education. They love it. They miss it. And we're just providing a resource. And you said something, Governor, about buying local. Imagine if every Mississippian took their $1,200 stimulus check and spent it in a local business that is hiring local employees. And those local employees can go to a local business and buy things from a business that's paying local employees. How many times over that $1,200 would be reused. That is an awesome plan, in my opinion, but your leadership, you can make those things happen for sure.
Well, thank you, Scott. Mississippians helping Mississippians is the theme of today, and there are so many ways that we as individuals can step up and do that. Innovation of entrepreneurs in Mississippi has been very, very encouraging to me, and our educational institutions have also stepped up. Now, I know you probably cannot tell this from his tie, but Dr. Josh Gladden is from Ole Miss, a vice chancellor, and so I'm going to turn it over to him for just a second.
Governor, thank you so much, and appreciate the opportunity to be here, and thank you for your partnerships. This is a trying time, and what's really heartening to see throughout this entire conference, press conferences, is all the different pieces, whether it's private sector, public sector, all coming together to solve a problem, and it's just, it's wonderful to see everybody step up and get ready to go. And it's been the same on the Ole Miss campus and in the Oxford community. Our folks, once conditions starting to worsen, we had folks just clamoring, what can we do to help? So one thing we knew we could do right off the bat is look at our shelves and our labs and in our centers, research centers, look for PPE that's just sitting on the shelf. So that was the first thing we did, goggles, gloves, face masks, things like that. And donate them, send them off to different medical centers across the state, including UMMC and Baptist Hospital. The other thing that we knew we could do, as you've already seen some here, is fabricate PPE. So we worked with Baptist on some face shields. We've been they're randomly red and blue. So. But these face shields we've been printing, the clear part is a disposable bit that they can take off and reuse this and just take off the infected piece. And so we printed about 400 of those. We got another 100 in the pipeline right now. And the last little piece I just wanted to show, which UMMC has told us is a real need, is nasal swabs. The traditional sort of wood, cotton nasal swabs don't work very well for testing. So we worked with them. Again, we didn't, like you were saying, there's a lot of great content online. Universities are just putting out in the open domain their different technologies. So we were able to download a print file. We're starting to make about 200 of these, 200 or 300 of these a day. Just drop some off at UMMC to do some testing and make sure we've got everything right for them. So thank you.
That is awesome. I will tell you those swabs, in my conversations with governors around the country, swabs are a major challenge, and so that's an incredible look. Next, we have from Mississippi State University, Dr. Julie Jordan, Vice President, and she's going to talk about what's going on in her neck of the woods.
Thank you, Governor. And on behalf of Dr. Keenum, I want to thank you for your leadership during this difficult time. And it's my pleasure to be here to share some of the things that we're doing at Mississippi State. Early on, one of the first things we did was at the request of MEMA, working with our electrical engineering department, and along with Taylor Machine Works, we converted over 500 ventilators from battery power to AC power and delivered those within less than a week back to MEMA. We have 2 young engineers in students who have figured out how to take a traditional truck toolbox and turn it into an ultraviolet light sterilization machine that's portable. The hospitals can put their N95 mask in it, and in minutes they can sterilize those masks, and instead of taking hours. And being portable, the hospitals can move it around into different areas as they need. But like others, every 3D printer I think on our campus is running 24/7, and our shields happen to be maroon and not red and blue. Our College of Veterinary Medicine folks, you may not know that we actually have a veterinary diagnostic lab here in Jackson and out in Pearl, and that staff have been working with the Mississippi Department of Health Public Lab in trying to provide extra personnel for testing. Like Josh said, we've given up all of our PPE from all of our chemistry labs and all of our biology labs to the local area so that other people can use those. One of the things too is, as home to our MSU Extension, we have offices in all 82 counties. And throughout this, we've been providing assistance to ranchers and farmers who are trying to understand new trade markets, to local governments who are trying to understand losses in revenues, and just to the public in general in dealing with the physical and mental health that are stressing at this time. But I think perhaps the most important thing that we're doing right now for our economy and our future economy at Mississippi State and at Ole Miss as well, y'all, we're open. We're having classes, and we are preparing that future workforce. And it's no small task a few weeks ago in 5 days' time for all of our instructors, our IT staff, our distance education staff to flip thousands of classes online in a very short period of time. And that happened all over the state of Mississippi so that our main mission of teaching and learning could continue, because that's the future economy. And we can't stop preparing our students. So this summer, we are prepared to offer more summer classes than ever before at Mississippi State University. They will be all online. And not only that, we're making all of our classes more affordable, because we know right now all of our families need relief and support in trying to get that extra education. So I would encourage our students and families to don't stop your education. The most important thing you can do for your community is continue your education and look to stay in school, go to summer school, and please enroll in the fall. Thank you, Governor.
Thank you very much. Our friends from Ole Miss and Mississippi State may not can agree on which color mask is best, but I think we can all agree of the need for that PPE and the need for those masks, and I want to thank every single one of you for what you're doing very, very much. Thank you all.
Thank you, Governor.
I want to thank all of you that are here today for your service for Mississippi. You have my sincerest gratitude for helping in this fight. These are by no means the only Mississippi businesses who have stepped up and continue to step up to support our efforts to combat COVID-19. There are many, many more Mississippians from every corner of our state lending a helping hand to their neighbors and their communities. I thank each and every one of you for donating your time, your resources, and so much more to help your fellow Mississippians. Because the only way we can beat this is together. We are all in this fight together. When we stand united, nothing will hold us down. When we stand united, we emerge stronger as a state, and when we stand united, we emerge stronger as a people, even if we have to stand 6 feet apart while doing it. I have asked Director Michelle and Dr. Dobbs to come up. I want to call on Director Michelle first. We did have some very challenging weather overnight, and I know that he is going to have an update there.
Thank you, Governor. Yes, just to give a real quick update, let me just first start by thanking all of you in the businesses. When we started this out, and this PPE was extremely scary, it really was. And all of you are patriots, and I just want to thank you. I know the governor has said it a number of times, but I want to thank you personally for the help that you've given us in this PPE fight. PPE dispersion continues to go on. We delivered today to the counties. We are fortunate, based on your efforts and what we've been able to put into the system, to be able to get more PPE out to the counties. Tier 1 facilities will be delivered to tomorrow, and we're delivering to them as needed on a regular basis. And staying on top of that. Storm update. The Easter tornado, we've talked about that a number of times. We have requested joint damage assessments. There's 7 counties that we're looking to add back to the declaration that we already got for Jones County, Jefferson Davis County, and Covington County. We're looking to add Carroll, Grenada, Clark, Jasper, Lawrence, Panola, and Walthall. That by no means would eliminate anybody else should your damages meet the threshold, but those are the counties we're doing joint damage assessments now, and we hope to add those back to that emergency declaration very quickly. Additionally, we're looking to open survivor assistance centers starting in Jefferson Davis, Covington, and Jones counties to assist those survivors with any unmet needs that they may have. We'll announce tomorrow where those locations are going to be, and those facilities will be ready to go to work and open up at 8 a.m. on Monday morning. The storms from April the 19th, damage assessments continue on there, and we're working very hard to get those individuals disaster grants in those counties that were affected from that. And then, as you all know, last night We had 14 counties that were affected from the weather, and last night was indication that it doesn't matter really what the forecast is on the weather. It can always get bad. We ended up having a lot of flash flooding. We had multiple high water rescues were conducted in Hinds County and other counties around, and then we had wind damage down in Pike County, Amite County, Lincoln and Copiah County, and all across the state. No assessments yet on whether those were tornadoes or straight line winds, but we should have that very quickly. And currently, Governor, we have about 20,000 are still without power, but the crews are doing a good job getting that back on quickly.
Thank you, Director Michelle, and I am told, and I'm very pleased to hear this, and I want to personally thank President Trump and his team that the Federal Emergency Management Agency did just approve our federal declaration request for the severe weather that occurred February 10th through the 18th of 2020. As you have heard me say, we had 5 federal emergency declarations. We now have 6 federal emergency declarations over the last 3 months. And these counties that have been approved for public assistance are Attala, Carroll, Claiborne, Clay, Copiah, Grenada, Hinds, Holmes, LaFleur, Warren, and Yazoo counties from those disasters that transpired back in middle of February. So thank you very much to FEMA and to President Trump and his team. At this time, I want to turn it over to Dr. Dobbs.
Thank you, Governor. A quick update. So today reporting 259 cases, bringing us up to a total of 5,153. Very sadly, we had 8 additional deaths to report, bringing us to a total of 201. If we look at our total testing numbers, as of April 22nd, Mississippi had tested 55,389 times, had done tests for COVID in Mississippi. We did break down the tests by race for the state public health lab, and it revealed that 37% of the tests were in African Americans and 61% were in Caucasians. Although that does mirror the population balance in Mississippi, we certainly recognize, because of the increased case burden, it does likely represent under-testing in the black community, something that we very much will work hard to correct as quickly as we can. The only other thing I would like to mention that looking at hospital utilization, we are at 78 patients with coronavirus on mechanical ventilators, 156 ICU beds for folks on coronavirus. Again, we're seeing relative stability with that, with perhaps a slow downward trend for folks on ventilation, but it's certainly a slow metric. As far as testing opportunities, I would like to announce a couple of places. 5 community health centers have done no pre-screening drive-through events this week. Tomorrow there will be one provided by Aaron E. Henry in Tunica, Mississippi. Tomorrow there will be one by Coastal Family Health in Gulfport, and then in Pickens, Mississippi by Mallory Community Health. So if you live in those areas and need testing, please do that. Today, the Department of Health, and with support and partnership with UMC and National Guard, has a testing event in Tougaloo, so please go to Tougaloo today if needed. And tomorrow in Kemper County and Oxford Conference Center, and then Saturday in Columbus and Belzona. Thank you very much, sir.
Thank you. Just to put some of those numbers in perspective, if you were to look at the University of Washington IHME model from March the 29th, which was a little over 3 weeks ago, admittedly it seems like 33 years ago, but it was a little over 3 weeks ago. They had projected that on today, which would be Mississippi's peak, Mississippi would need 7,990 hospital beds. As Dr. Dobbs just said, we have a little less than 400 patients that have been hospitalized as of today. They said we would need somewhere in the neighborhood of 1,100 ventilators. As Dr. Dobbs told you, we have 78 current patients on ventilators in the state of Mississippi. Now is the time to recognize that our approach is working, that what you as Mississippians are doing to social distance is working, that the necessary steps that we have taken thus far are working, but now is not the time for us to take a victory lap. Now is the time for us to be even more focused on making sure that we protect ourselves and protect our neighbors. And as we move into the coming days and weeks, we must continue to protect. We must continue to wear masks when we go out into public. We must continue to stay socially distanced. And we must continue to know, while some of the restrictions are going to loosen, that if you can stay home, stay home. And most importantly, for those of you in the vulnerable populations, those who as defined by the President's guidelines to reopen America, those over the age of 65, those who have pre-existing conditions, please stay home. Please do not subject yourselves, if at all possible, to putting yourself at an even greater risk. And so, again, with that, I will open the floor to questions. Yes, ma'am?
There was some pushback with Georgia's governor about them opening up, and I know you're trying to make your decision this upcoming Monday. Do you feel any pressure to make sure that the restrictions stay in place that you have now, or to open back up?
Well, I will tell you, I have great respect and admiration for the governor of Georgia. He's a personal friend. I don't know all of their data because I haven't spent the last 3 months of my life studying their data. I've been focused on ours. And what I will tell you is when you look at the actual numbers and the justification, we believe that we are very justified in being responsible and taking a cautious approach to reopening. As you know, this week we took a small step towards reopening our economy, and we have every intention of continuing down that path. But what I want Mississippians to understand is, do not think of this potential reopening in terms of a light switch, which is either on or off. It's not either 0% or 100%. Think of it in terms of the dimmer, where you can actually change the quality and the quantity of the light, and you could maybe go from 30% to 40, or from 45% to 60%. And so what you're going to see us do in the next, and we'll announce our final decisions tomorrow. We've been having conversations the better part of today, and we'll continue until the better part of tonight. You're going to see us loosen some restrictions, but we're not going to loosen all restrictions. In fact, quite the contrary. We're going to continue to see social distancing. We're going to continue to regulate some areas of the economy, but we've got to start moving towards continuing to move in the right direction to open more and more businesses. Cordia?
I know that you asked folks for patience as it related to calling in on the unemployment line. We're getting lots of messages about the pandemic unemployment assistance line in particular, saying that folks are staying on the line for hours only to be disconnected. Are you aware of any particular issues that are happening with that line or that new call center that folks need to know about, or what do you want those folks to know?
Yeah, well, what I would tell you is I'm sorry that has happened, if it has happened, and I'm not at all suggesting that it's not. I feel certain that it has. I'm sorry that has happened. The demand is overwhelming. We went from less than 1,000 up to 45,000 new claims last week. We did have a downtick this week. The numbers that came out today showed approximately 35,000 new people got online and were successful in filing unemployment insurance, and we're continuing to ramp up the number of people. And so the downtick is really, I do think there was less people applying, which has put a little less pressure on the system. But with our announcement 2 days ago, and it was just 2 days ago, with the PUA now being in our computer system, and by the way, we did that quicker than just about any other state in America. Very few states can you go and qualify for the PUA like this, but it has put additional stress on the system. And so we are going to continue to build capacity there. Please be patient. We are working very hard to get that particular line fixed, and quite frankly, very hard to build capacity to deal with not only the PUA and that new line that came on, but the old line as well.
Dave Elliott from WLOX has a question. Dave?
Good afternoon, Governor. I was going to ask about that. We're hearing hundreds frustrated. It's getting more and more difficult to tell a patient to hang in there and keep trying. But I want to ask you, in terms of restarting the Mississippi economy, what role will Dr. Dobbs and other health professionals, the scientists, in determining protocols and best practices to make sure we don't jump the gun and force to live with unintended consequences down the road?
Well, thank you, Dave, and I believe I heard the gist of your question. Let me first address the initial point, which is the individuals getting frustrated as it relates to the unemployment insurance. I know people are frustrated. I am frustrated. I also know that we went from less than 1,000 per week in new claims 4 weeks ago to now we're doing over 140,000 new claims a week, or 140,000 claims a week that's additive over the last 3 weeks, and everyone has to reapply on a weekly basis or actually reconfirm that they are still eligible. And so I know that they are frustrated, and we are working diligently to get that fixed. The question that Dave asked was what role, I believe he said, what role, if any, would Dr. Dobbs and his experts play in the reopening of the economy? I'll answer it, and then I'll turn it over to Dr. Dobbs. He will play a critical role in helping us make that decision. In fact, every single step of the way throughout this process, we have been engaged with the health department, with Dr. Dobbs, with Dr. Byers, with their entire team, with Jim Craig when we were building capacity from a PPE and hospital bed standpoint, et cetera. And as we go into the gradual reopening process, Dr. Dobbs will not only have a seat at the table, he will have the most important seat at the table from my perspective. And so, Dr. Dobbs, you want to talk through that? You certainly may.
No, thanks, sir. I'll just say that every step along the way, every decision has been made with painstaking attention to detail, using data available to us to make the decision. This is uncharted territory, and so it does take a lot of focused attention, and Mississippi's situation is different than other places. And so it has to also be a tailored decision based on the reality here. So, just like it has been the whole time, the data and the science has driven the decision-making, and that will continue, I have no doubt.
Thank you.
Allie Martin from WCBI has a question.
Great.
Allie?
Yes, hi, as you know, more Mississippians are ready to go back to work. They're also ready to go back to church. Matt Stabler over at Liberty Council has called, I think, for May 3rd to be reopen church Sunday nationwide. What maybe can folks look for as far as getting back into church? What restrictions may be in place? What words of encouragement?
Well, thank you, Allie, for that question. And the question was regarding when can we get back in church, and once we get back in church, what would those restrictions look like? Let me begin by saying churches are not closed. I don't believe that the state government, and I don't believe any local government has the ability to shut down a church. I believe our freedom of religion in the United States Constitution ensures that. The approach I've tried to take is strongly encourage our pastors to recognize the risk that can happen in a community when large groups of people from out in the community come into one building, get into close proximity, then go back into their communities. That can lead to significant spread. We haven't had major community spread in any community in Mississippi, major community spread, but some of the community spread that we have had, particularly the ones from early on, as Dr. Dobbs and his team, and by the way, they have been in contact with and worked on contact tracing from the very beginning. It's been our strategy, and so they've been in contact with those individuals who have contracted the virus. And some of the worst cases of community spread out there happened either at weddings or at funerals. And that really stands to reason. If you think about it, both of those are emotional gatherings, and people in Mississippi like to hug. Sometimes if it's a bad situation, we like to cry, and we hug each other once we are crying at a funeral or we are crying out of celebrating. at a wedding, and we hug each other then too, and then we get on dance floors maybe and dance too closely together and all of that, and it just lends itself to very big challenges. And so what I'm encouraging everyone to continue to do is to continue to practice church services online. Certainly you can do drive-up services if that's what you want to do, but I encourage everybody to keep their windows up, and for families that are staying in one house or one dwelling to stay in their cars and not get out and talk to other people, because that will lend itself to significant potential challenges. We are going to get back to a more normal opportunity for church, but I don't think it needs to be in the next week or two. And so, and once we get back, just so everyone knows, we're probably looking at encouraging social distancing guidelines even in our churches for the foreseeable future. But we do not think, given where we are in our cycle, that it makes sense right now for us to subject a lot of people to risk by having large numbers of people in our sanctuaries.
Follow up to that, because we had also been getting a lot of questions for folks. Obviously, the spring and summer is a busy time for things like weddings. As folks start thinking about what is in their best interest in terms of moving things, should they just go ahead and anticipate that they should plan for fewer people, even if it's several months in the future? Or is it too soon to say?
Yeah, I can't speak to June and July personally. Dr. Dobbs may have an opinion on that. I'll certainly turn it to him. I can't tell you with certainty what June and July are going to look like. You know, there's a lot of data out there that suggests that the summer months tend to slow viruses in general and coronaviruses in particular, but none of those studies have anything to do with COVID-19. And the one thing that we have found with COVID-19 is you should probably expect the unexpected. And so while I hold out hope and pray that the summer months are going to bring a reprieve in terms of the spread of the virus, I don't think we can definitively say that at all.
Yeah, it really is impossible to say, but I think what is pretty comfortable to say is that normal gatherings throughout the summer are extremely unlikely to be safe.
Caleb from Daily Journal has a question. Caleb?
Yes, have we seen any appreciable increase in the turnaround time of testing? I would think, especially as we start to loosen restrictions, it would be important to be able to have quick turnaround on testing so we can monitor any potential spike in any parts of the state.
Yeah, that's a good question, Caleb. We are testing, over the last, 3 to 5 days, 7 days maybe. The word testing has become the hot word in America. Some of these governors have figured out that testing might be important now that they spent weeks and weeks talking about ventilators, and the healthcare systems of America were not stressed to the point where ventilators became an issue. My impression is that every single American that needed a ventilator to this point has gotten one, with very, very few exceptions. And so now the notion has become that, hey, we got to be able to test before we can reopen any economy. And in Mississippi, what I'll tell you is we've been talking about testing since day one. We believe that testing was a critical component of our overall identify and isolate strategy. To be able to identify and isolate, you have to be able to test. That's the reason when you look at the most recent data from a public source, that Mississippi was listed as the 6th highest testing state per capita in America. And just to make sure everyone understands, the states that were above us, at least most of them, New York, New Jersey, Rhode Island, Louisiana, all had major federal support in their testing over the last 3 weeks. Now, why did they have major federal support? Because that was where the hot spots were. And I'm not being critical of the feds for doing that. I understand it. But if you take them out of the equation, Mississippi is a shining example of a state. And by the way, I give full credit to Dr. Dobbs and his team for the recognition of this. And I also give full credit to our partners at the University of Mississippi Medical Center and the University of Southern Mississippi, and at our private labs and at our hospitals throughout the state, who recognize that testing was important. But you're right, Caleb. as we move into the next phase, testing is going to continue to be critically important. And so we're having conversations that really are across the board. We're talking about how do we increase capacity for testing. We're talking about how do we increase capacity for the ingredients that are needed for testing. And also we're having conversations about how do we do things such that we push more of the cases that maybe are of less risk, so that we free up capacity at our state lab to focus on those highest at risk, so that we know that we can get those turned around in a quicker way. We don't have a lot of control over the private labs in terms of how long it takes their tests to be returned to our state, but we do in a public lab, and so we're building capacity at the lab and also working to ensure that we have those testing capabilities that will allow us to continue our strategy, because no matter what steps we take next, no matter what decisions we announce tomorrow, we are continuing with our identify and isolate strategies and utilizing our contact tracing teams that have been built up beautifully by the Department of Health, and make sure that we're continuing to doing the things going forward that has allowed us to, by the way, have, if you look at national data, we have more positive tests on a per capita basis than many other states. And the reason for that, in my view, is not because we have more positive cases, it's because we've done so much more testing than so many other states. And that's a good thing. We think that's a positive because we're able, the more positives we can identify, the better we are. Yes, ma'am.
There still hasn't been, I guess, like a detailed plan on dealing with the inmates, especially in like Parchment and things like that. There's a fear with families contacting us saying that they believe that their family members, may be exposed to the virus. Any update on those masks or protective measures, especially since some of them are actually starting to produce these items?
Yeah, well, I will tell you that there's an immense amount of fear throughout the state with respect to the virus. There's a lot of concerns, and I'm sure that there are those family members who have inmates that are concerned as well, and I certainly understand that. We have, as we announced yesterday, we have tested approximately 22 or 23 inmates. We've had almost all of them have come back negative with the exception of 4. We have tested even more of the staff members that were potentially symptomatic, and we've had approximately 4 staff members that have tested positive. We sent them home immediately, as you would expect, to isolate them. We cut off visitation very, very early on to our prison system, which obviously reduces the risk of someone from the outside bringing the virus in. And we're continuing to implement the protocols that we put in place from day one, which is if you have symptoms within the system, you go to the infirmary, you get tested for the common flu, you get tested for strep throat, and if both of those are negative and you continue to have symptoms, then you get tested for COVID-19. And so we're going to continue to look at that. I'm very pleased that we've got inmates that are actually working to increase PPE. We have certainly had conversations regarding delivering that to critical healthcare workers at the various facilities. But we have been fortunate thus far, unlike many other states and certainly unlike the federal system, in that we have not had massive outbreaks, and we're continuing to do everything in our power to protect those that are in that system. As I promised, 3:30 is the longest I can stay today. I just want to, again, I want to thank everybody in this room who represent literally hundreds of thousands of Mississippians who are getting up, going to work every day, and are providing for themselves, providing for their families, and providing for their fellow Mississippians. Thank you all, and God bless.